Welcome to the Health Feeds Performance podcast, where we believe that whole body nourishment is a requisite for athletic success. I'm your host, Ian Craig from the Centre for Integrative Sports and Nutrition, and today I'm talking to functional medicine doctor, Dr. Ruth Wilde. Our topic today is joint health, and unfortunately in medicine, joints tend to be viewed as mechanical structures, either to be trimmed by surgery or replaced later when we've actually worn them out. But thankfully, I've found a doctor that thinks a bit differently. When we go into functional medicine, everything in somebody's life has an impact on every body tissue. So that's what I'm going to be exploring with Ruth today, trying to just tap into how she thinks about such cases. So, Ruth, thanks a lot for joining me. Can you start just by sharing with our viewers and listeners a little bit about yourself and what got you into medicine and what got you into functional medicine?
Yeah, hi Ian, thank you. It's really lovely to be here. I'm grateful for the invitation. So I think my background and journey to where I am today has been varied and fairly interesting. So I started off traditional kind of medical school training, but I actually joined the military as a cadet during medical school. And that obviously exposed me to certain types of people. There was very much a kind of physical fitness focus through that. And then going on through working various military jobs. So I did emergency medicine, I did family practice within the military. I worked in the Defence Rehab Centre at Headley Court as was, and that was fascinating kind of exposure to sports and rehabilitation medicine, really. The very highest standards and at the kind of the forefront of the research into those areas as well, seeing patients with multiple injuries and patients who'd previously been extremely fit. We're talking about the paras and the Marines, etc., and people who'd suffered huge injuries of all different sorts. So that was a really very interesting insight for me and a huge opportunity to start seeing how a kind of a holistic whole person approach was brought in with their multidisciplinary teams there. And then along the way, I guess I became injured myself, a back injury, and ended up actually at the rehab centre as a patient. So then another very interesting insight from the other side, and starting to realise that whilst there was an awful lot that was addressed through the traditional medical approach, there was still a huge amount that wasn't, and that those components of healing were really central and were being overlooked. And I think that was where my journey into sort of the functional approach to medicine started. I went off and did an introductory course through the Institute for Functional Medicine over in the States, and suddenly found a room full of practitioners who were speaking the same kind of language and understanding the truly personalised individual approach to healing and recovery and ultimately wellness and long-term health. So that started that side of things. And then along the way, further personal experiences, working alongside the recreational athlete community, and then also my husband, who suffered a severe traumatic brain injury 5 years ago, really made me dig deep into my toolbox to look at all those components that are so crucial to recovery, health and well-being, etc. And through that, then I connected with Chris Hendy at Strength for Endurance, who was Grant's one-to-one personal rehabilitation trainer throughout the first few years of his recovery. And now I still work with Chris and his team, his multidisciplinary team, supporting recreational and semi-professional athletes and looking at how we can optimise their health and well-being for the long term, and particularly help them prevent injury as far as possible, and also promote recovery from injury where that's necessary. That's kind of where I am at the moment in a nutshell.
Thanks, Ruth. So there's a lot of practitioner journey there as well as personal journey for you. I want to just sort of bring up a notion that you hear in medicine to start the joint discussion, and that's that joints have a poor blood circulation and therefore they're very hard to heal or rehabilitate. And when you have injury there, there's not too much you can do. Is that a fallacy? Is there partial truth? What can we do about, blood supply in the joints?
Well, I think it's probably fair to say that the blood supply to joints is complex, not poor, but complex. And it very much depends also on the different types of joints that we're talking about. Certainly the cartilage portion of the joints is avascular, i.e. does not have a blood supply, but there is still blood supply to every other aspect of surrounding tissue of that joint, the bones, the ligaments, the tendons, etc. And then when we think about the different types of joints as cartilaginous and primarily then synovial. Synovial is probably the joint type that comprises the most of our joints within the body. So those joints are lined with the synovial fluid, and the synovial membrane itself does have a rich blood supply. So absolutely, it's crucial to make sure that the vasculature that supports all of our joints is supported to enable that the blood delivery and the nutrient delivery to those tissues is optimized as far as it possibly can be. And there are then multiple components that come into that from a nutrition point of view for sure, but then also supporting the cardiovascular system directly as well.
Cool. So it's too simple to just say, hey, it's got bad blood supply. If you're just focusing on the joints as being cartilage, then maybe there's truth in that, but the joint has a lot of structures around it. You mentioned bones. So joints are obviously where bones meet and have to be articulated. So how important is bone health integrity in joint health?
Yeah, absolutely. I mean, the structures surrounding the joint itself are absolutely crucial to the function of the joint, and bones being one of the huge components there. We'll probably go into muscles, ligaments, tendons, etc. later on, but just in terms of nourishing bone, you want to think about the structure and also the bone density for sure, and that's something that we really do think about in particular in relation to the types of training that people are doing and what supports bone density and what could potentially compromise it. And then we think about hormonal balance and the impact that has on bone density. And I guess we're thinking there particularly about female hormone balance, particularly as we move through the different phases and stages of our lives where bone density is influenced by reduction in hormone levels, particularly estrogen levels post-menopause. And then we're thinking about how best to support that at different stages and the ways that we can approach that, again through nutrition, through training, and sometimes we have to add in some extra support depending on what somebody's goals and aspirations are and what the health of their joint is. So we can do bone density scans to assess the bone density and look for any early signs of thinning, so osteopenia, slight decrease in bone density, and then what we want to avoid is moving into the osteoporosis kind of arena, because that just puts people at hugely increased risk for fractures, and then obviously there's that component that will then have an impact on the joints which are surrounding the bone where the damage has taken place.
So we tend to view joint, let's call it joint distress, opposite of joint health, as a wearing. So I'm a runner. If I've done X number of miles per week for 10, 20, 30, 40, 50 years, as many runners end up doing, then there's this kind of wearing down. It's almost like tires on your car that eventually get worn down. That's the kind of common view to it. But in a functional approach, you've mentioned a few things around the bone health there. Mm-hmm. What else in a person's life could cause the joint distress or joint breakdown over time?
Yeah, absolutely. So we talked about bone health, we talked about the surrounding structures, and we talked about the blood supply in and around the joint itself as well. So I think one of the key things that I look at, there's a sort of joke in functional medicine that we're not doctors, we are inflammologists. So what we look at are drivers of inflammation in a body system, and I think this is something that we all need to bear in mind. So whilst inflammation is an important component of the healing and recovery journey, and our bodies are designed to support that inflammatory process in the acute phase. When there's an injury, we have to get the white blood cells and all the healing component parts to that area that's been damaged. But what we don't want is chronic inflammation, because that then leads to ultimately compromise of nutrient delivery to those tissues that are trying to heal, compromised blood supply through inflammation within the blood vessels themselves as well. And that's a very disadvantageous state to be in. So what we want to do is look at potential drivers for inflammation, and these are absolutely across all the different lifestyle areas. We're not just talking about inflammatory drivers from food, because I think probably most people accept that a diet that's high in sugars, particularly the higher glycemic index sugars, is going to be a driver of inflammation. But we also need to think about our sleep patterns and how poor and compromised sleep actually can be a driver for itself, in terms of it doesn't allow healing and recovery and repair. It can push up our cortisol levels ultimately if we're having chronically poor sleep, and that will lead again indirectly to blood sugar dysregulation. That rising cortisol drives the release of glucose into the bloodstream, and it also compromises our satiety and our hunger signals, making us think that we have a higher requirement for those higher carbohydrate foods than we actually physiologically do. So that's something to think about, sleep. And then we think about the other things that we're exposed to. So unfortunately, exposure to pesticides and toxins, from personal care products through to what we're cooking with in our kitchen, our plastics, etc., our cling film, all manner of things that we can be exposed to. Even now, more and more research going into EMF exposure, thinking about where our phones and gadgets, etc., are throughout day and night, how often we have our Wi-Fi on. All of these things, there are so many factors to consider in terms of chronic drivers of inflammation, and all of these things indirectly will ultimately impact on joint health in as much as they will impact on whole body health and well-being.
Cool, I got more than I bargained for with that question. Okay, so I want to unpack it a wee bit because you said a lot. You talked a lot about inflammation and contributors to inflammation. So I think I'll swing back in a little bit about nutrition and inflammation, like beyond the sugar component. You mentioned cortisol and cortisol dysregulation. So you gave the example of sleep can throw out cortisol levels, and obviously lifestyle stresses, too much training can throw out cortisol balance as well. Can you just kind of emphasize the connection between cortisol and insulin, and how that cortisol can disrupt blood sugar regulation, which as you mentioned before, sugar itself can be pro-inflammatory, but a dysregulation of blood sugar can be pro-inflammatory as well. So can you just sort of say a wee bit more about that?
Yeah, absolutely. So we all need cortisol. Cortisol is not the enemy, and glucose is not the enemy either, but it's about having what we need available at the times that we can actually use it. So cortisol is an important part of our stress response, and we need this for survival. I think what's happened though over time, and evolution essentially is what we consider to be stressors now and what our bodies consider to be stressors are not what they were. So we are definitely not being chased by tigers anymore, but we are under threat from overflowing inboxes and people expecting responses instantaneously, if not sooner. And, you know, the fact that, I guess, as people do actually live longer, maybe not healthier, but live longer, we end up with generations such as ours and people in the sort of 40s and 50s who are sandwiched between multiple responsibilities of, you know, caring for parents, caring for children, juggling a career, and then if you throw in recreational athlete aspirations or semi-professional, professional athletes as well, you know, people have got huge numbers of things to juggle. So it's not unreasonable that our adrenal glands, where the cortisol is produced, will mistake some of those things for that tiger and kind of go into overdrive under certain circumstances. So anyway, in terms of your actual question, how does cortisol relate to insulin? So when cortisol goes up in response to any kind of stressor, what it does is it releases glucose, which is stored in the form of glycogen, usually packed around the liver, largely speaking. So the glucose gets released into the bloodstream so that we have that readily available to fight or to flee, depending on what the stress is. And then if we're not using that glucose, because actually the stress is simply the inbox, the glucose remains floating around in the bloodstream, and through our homeostatic mechanisms, which are always looking for balance, what happens is the pancreas releases the insulin to try and bring that blood sugar back down again, going, well, we don't need this much glucose floating around. Here we go. Insulin, that's a normal response. But what will happen then, if the blood sugar spike's been particularly high, the amount of insulin released is going to be significant, and that can then lead to a dip / crash of blood sugar, which leaves us going on a bit of a roller coaster where we have our surge of cortisol, surge of blood sugar, think we're ready to go, but then rapidly followed by the surge in insulin, leading to the blood sugar dip, which leads us maybe 90 minutes to 2 hours later feeling pretty awful again. Either a dip in energy, focus, concentration becomes more challenging, a dip in mood sometimes as well. Some people are more prone to that hangry kind of experience than others, so we will feel pretty grumpy and irritable when our blood sugar dips down below where we would have it optimally. And then if we're feeling those things, then what our response tends to be is, oh my goodness, we have to reach for the carbohydrate again to pick that blood sugar up, or we reach for the caffeine to give us a bit more of a pickup because we feel that dip and then we go back through the cycle again. So when we're reaching for food in the midst of a blood sugar dip, we tend to go for the more high GI foods again, which again leads to that rapid rise in blood sugar, which is then followed by the insulin, followed by the blood sugar dip. So we can end up doing this throughout the day with our blood sugar. And that process of like rapid peaks and troughs between the blood sugar levels drives this inflammatory process. And over time, that then can cause significant damage, certainly at like the microvascular level, so in the capillary beds and what have you, and that will, as we talked about before, lead to compromised blood circulation to all of our vital organs and to our joints.
Nice. So you came all the way back round to the first question there.
Got there, yeah.
All right, so blood sugar regulation is really, really vitally important, and our modern day stress is not helping us. And that all impacts on our joints. And I'll just add in this sort of metaphorical load as well that we're carrying on our backs or our shoulders, which are loading our joints. So yeah, it's a big aspect. So when we're in a sporting realm, we have to ask our clients or ourselves, are we adding to the load or are we taking away from the load? So finding that, yin-yang balance is really, really vital. You also mentioned toxicity, Ruth. So we tend to kind of like park that to one side. There's toxicity, liver detoxification, and then we get inflammation's a different system. But actually, when you know functional patterns in the body, it's completely interlinked, isn't it? Do you want to just say a little bit more about that?
Absolutely. So this is always a component part of my consultations with all my new patients. We go through their lifestyle areas as their foundations for health. So we'll always talk about sleep patterns, we'll always talk about nutrition, we'll always talk about movement and exercise, and we'll talk about stressors and their stress management techniques and tools in their toolbox. And as part of those stressors, toxicity comes in. So as I briefly mentioned before, toxicity in terms of life load is definitely one thing, all of our multiple commitments. But then we think about the toxins we're exposed to through so personal care products being one of them. Those particularly deodorants and things can have a high content of aluminium. Aluminium is one of the metals which can compete with the iodine binding sites, and that can indirectly lead to compromise in thyroid function, for example. And then we think about other things like the BPA in plastics, which is often in our kitchen containers, and if we heat food in a plastic container, the BPA can leach into that, and the BPA can have a direct impact on our hormonal system as well. And we have things called xenoestrogens, which can actually act like an estrogen in our body, even though it's from a synthetic source. That's another form of toxicity that we need to consider, because clearly hormonal balance is crucial for all of our metabolic pathways and homeostatic mechanisms, and bone health as well. So we don't want things throwing out our hormone balance unnecessarily either. So so there's multiple other ways, and then we think about the pesticides that are sprayed onto crops. So if we're having foods which are not organic foods, we can potentially have a heavy load from that, which will then directly impact on the jobs that our liver has to do. We also think about medications, particularly where we think about, I guess, athletes and injuries and joint injuries and things, and musculoskeletal injury generally. There may very well be periods of time where they'll resort to paracetamol, anti-inflammatory drugs, sometimes opiate drugs. All of these medications will add to our toxic load in terms of what our liver has to metabolize and process. And some of those medications then as well also will impact other areas, like again our hormones. So there's studies which have shown time and time again the link between opiate use and testosterone levels in men, for example, and there's a direct correlation there. So we have to think whole body, big picture, and it's not quite as simple as just toxicity equals a liver load. It's the whole human kind of organism, as it were.
Thank you. So there's a lot to think about. I want to just pick on the medications that you mentioned there. So a colleague of mine who's written for a magazine I used to edit, Functional Sports Nutrition magazine, he's a pharmacist called Mike Wakeman, and he wrote a book called Medically Malnourishment, I think it was. And it was basically unpacking the drug-nutrient interactions or the nutrient depletions that come from common medications. And in that book, he said that athletes actually medicate to a much higher level on average than the average non-athlete, which is quite interesting because we're meant to be the epitome of health. But athletes are very prone to injury because they're pushing so hard, and illness. So then things like antibiotics come in, non-steroidal anti-inflammatories. So there's a bit of a picture there as well that definitely needs to be considered when you're working in a functional medicine space. You also mentioned EMFs. So that's electromagnetic frequencies or fields. So what I've read about them is they can disrupt the oxidative pathways, creating more oxidative stress. Is there anything else you want to sort of add to that discussion of toxicity?
Specific to EMFs or more broadly speaking?
Yeah, anything that's triggered in your mind right now.
Well, I would be quite keen just to re-emphasize your point there about the medications commonly used by athletes and the nutrient depletions that fall out from those. Is that you happy for me to go there briefly? Yeah. Okay. So thinking about thinking about the sort of common groups of medications, there are a few key things to say. So paracetamol, really commonly used. I just want to say that even if you stay within the recommended daily allowance for that, that doesn't mean that's okay. There's still very much a job that your liver has to do to detoxify there, and depending on your genetic pathways, those that might be more or less efficient for you, and over time it's that cumulative amount of work that your liver has to do. So you say, okay, well, I'll only take paracetamol for a few days, I'll only take 4 grams a day, that's fine. Come back and do it multiple times over the course of your athletic career. That still adds to the cumulative load that your liver is doing. When it comes to the anti-inflammatory group of drugs, they have been shown to have a direct impact, not just on the metabolic pathways, but also on your gut microbiome. So this is something we really need to consider. It doesn't take more than a day or so to actually change that very delicate, intricate balance of the microbes within the gut, which are absolutely interlinked with the way that we can extract the nutrients from our food and with our hormonal balance, and with a whole host of other things, with our neurotransmitter balance, etc. So rocking that microbiome balance is something that we should not take lightly. So your ibuprofen, your naproxen, those types of medications are really well known for that, and also for starting to disrupt the lining of the gut as well. So over time, again, it's the cumulative load. It's not just, I'll take it for a few days, that's okay. But if you do that multiple times throughout your athletic career, that all adds up. And what does that then look like? And we don't know, without doing a large amount of testing, as to how that would affect a particular individual. However, what we can say is that it does cause disruption. And then moving on just briefly to the steroid group of drugs, which can be used in extreme circumstances if there's chronic inflammation, chronic pain. Multiple clinicians will resort to the intra-articular injection of steroid because it tends to give very good relief in a lot of patients for maybe a few weeks. But those steroids over time, again, will actually directly impact on not just blood sugar regulation and mood, but bone health as well. And over time, cumulative exposure to steroid can absolutely lead to a thinning of the bone, as it kind of decreases the osteoblast activity. And we see this not just through steroids for pain, but also people who use steroid inhalers when they are asthmatic. That's another source of cumulative kind of toxicity from those steroid medications that we need to bear in mind.
And all of which can impact the joints at some level.
Absolutely, yes, it can.
So you went into the microbiome there, which is a really pivotal area, and it's now thankfully got into the sports nutrition and sports medicine world. You mentioned medications, but athletes that aren't taking medications, what do they need to be considering to be nourishing their microbiome? I was about to say mitochondria, that as well. And what do they need to be avoiding in their lives that might dysregulate microbiome function?
So, as I say, the microbiome is shifted very quickly from a couple of days really through what we're putting in the top end first and foremost. So the foods that we eat, they will all have an impact on the microbe balance there, and not just the types and variety of food that we eat, but also how efficiently we're digesting that food as well. So this is fairly complex. We're thinking about the whole process of digestion as well as what we're actually putting in. So from a what we're putting in point of view, variety is definitely key to encouraging a very healthy, diverse population of microbes within the gut. That's beneficial. What we need is a huge number of different bugs doing all the different jobs, rather than just continuing to encourage a particular population of microbes to grow over and above the others, because that leads to an imbalance. So I guess it's like having a community and everybody has a job to do within the community. If we were all doing the same job, the community really wouldn't function. That's the same for the microbiome in the gut. We need variety. So of a wide variety of fruits and vegetables in particular, and different types of fibres. Those are going to really help promote that diversity. And then going back to what I was saying about the whole process of digestion. So our large bowel in particular, where the microbiome largely is supposed to live, is really designed to digest foods which have already been very well digested on the way down. So that starts even before we eat with our what we call cephalic phase of digestion. That's anticipating getting our actual digestive system ready. And then the chewing, the mechanism of action of chewing starts again and then releases enzymes in the mouth as part of that early process. Then when we get down to the stomach, and this is a really key area for athletes, the stomach needs an acidity to it to also then help particularly with the digestion of proteins. Over time with chronic high loads, high physiological stressors, we deplete our stomach acid production, and that can be a real source of compromised digestion for a lot of people, not just athletes, but for athletes with that particularly high training load, etc. And when stomach acid levels are compromised, that can often lead directly to sort of uncomfortable symptoms of bloating and digestive disease following meals, because we're not breaking down our protein adequately at that level, and then it's going through down into the small bowel in larger chunks, for want of a better term, than it should be. And then that's encouraging bacteria to go ahead thinking, whoa, this is an amazing feast. Haven't seen stuff like this for a while. Let's all go here and let's go start attacking these big particles of protein up in the small bowel where they shouldn't be. And that very much can link in with symptoms of bloat and digestive discomfort quite soon after a meal. So, and down the line, if that happens chronically, the bacteria shifting up into the small bowel, we end up with this SIBO issue, which is a small intestinal bacterial overgrowth, which is a whole issue in and of itself. Anyway, so we need the stomach acid to be adequate, and then moving on down further, we need our pancreas to do its job as well. So our pancreas needs to release a bunch of other digestive enzymes. We need our gallbladder and our liver to do the things with the bile and the bile salts and digesting fats too. And the way that our system best does all this is if it's in nice rest and digest mode. That means our brains being in nice rest and digest mode from the outset before you're even sitting down to your meal. Because again, if you're sitting there in fight or flight mode feeling, oh my God, I haven't got to my inbox, or my kids have just done this, or my cat's just done that, then you're kind of already hyped up. And that doesn't allow for the nice release of stomach acid, nice release of pancreatic enzymes, etc. So you'll get larger undigested particles of food ending up further down in the gut. And that promotes the overgrowth of certain adverse types of bacteria. You don't really want to promote the growth of the bacteria that love the big chunks of food, because that can really lead to a significant imbalance within the microbiome. I think I'll pause there, Ian, as I've probably said enough.
Thank you. We're getting a great physiology lesson here. Thanks for emphasizing the whole gastrointestinal tract, because the papers I've seen coming out in the sports and nutrition world are very focused on the microbiome. And as you say, that should be lower down. And as practitioners, we need to do a lot before we're talking about the large bowel, we need to get them chewing and anticipating and the stomach working and so on. So I view it as a cascade. But science is science, so it needs to reduce into sort of small detail, and then it's microbiome and probiotics. But you've given us a much bigger view, and everything is involved in that. The question may arise for some people who maybe haven't made the link, but well, so what? What's the link to joint health? You know, if the gut's not in a happy place, why does that affect the joints? Can you make that connection for us?
Yeah, sure. As I said earlier, the types of bacteria that we have in our large bowel are really there designed to enable us to extract nutrients from our food. And that's once the large bits have been digested to a certain extent, well, then we're going to be wanting to extract the micronutrients in particular. So we're thinking about, our iron, our B vitamins, our fat-soluble vitamins, all of these things which need to come out, and we need to enable energy generation at the cellular level. We even need to nourish the cells of our bowel itself. So we need to think about that, and we need to think about then those nutrients getting to the joints. So they need to be taken up into the bloodstream, and then the circulatory system also needs to be adequate and delivering those nutrients efficiently, along with the oxygen, etc., that the tissues need to flourish. So we're thinking about what's within the microbiome in terms of adequacy of nutrient extraction. That's one thing. So over time, if the microbiome's imbalanced, and also if the gut lining itself is compromised through, again, usually kind of chronic stress, the gut lining and the immune defense within the gut is compromised, and we can lead to a situation of leaky gut, which I'm sure many of you have heard of, which was very poo-pooed by the traditional medical community for a very long time. But I think in the last few years, they're starting to grasp the concept, and things which make the gut more leaky allow larger particles to cross into the bloodstream, and those particles are then, or they risk being recognized by our immune system as foreign invaders, which means that the immune system goes on to attack mode, and doesn't always just keep its attack around those food particles. Over time, if large particles are crossing, which shouldn't really be taken up into the bloodstream, and the immune system is hypersensitized, it can then start to divert its attention elsewhere and attack other tissues within the body as well. So there's potential for that leaky gut, upregulation of the immune system, chronic inflammation, and then also ultimately that the worst case scenario with that becomes like an autoimmune process, when that inflammation has been chronic for so long that then the body kind of turns on itself, or the immune system turns on the body tissues and starts to attack there. So that can then manifest in things like rheumatoid arthritis, direct impact on the joints, or other body tissues like autoimmune thyroid disease, Hashimoto's, things like that. So there are very clear but multiple step connections to gut health from the microbiome and the gut health itself.
So gut's very much the seat of immune-based inflammation and how that mirrors out across the body. So you mentioned rheumatoid arthritis in an autoimmune context, but even osteoarthritis, that's going to be fueled by inflammation elsewhere in the body as well, isn't it?
Absolutely, and it's very interesting. I mean, within my clinical experience, often taking out some of those key drivers of inflammation will help to significantly alleviate the discomfort from osteoarthritis. And even prior to the radiographic changes, which are defined then as osteoarthritis, even prior to that, just joint discomfort, but then the osteoarthritis and also the rheumatoid arthritis, all of that whole spectrum of joint health imbalance can be influenced through reducing inflammatory drivers. And sometimes for a period, you have to take out certain specific food groups or food types to really help to do that through the gut itself. That can be a really good place, a very useful place to start. And I will just allude to this because I know lots of people may think cynically about the gluten-free kind of movement, and I'm not necessarily saying I advocate that for people for the long term, but certainly it can be hugely beneficial to have a trial period of maybe up to 3 months, removing gluten completely from the diet, and sometimes removing dairy from the diet as well, or instead of, can be really useful in terms of reducing dietary drivers of inflammation, because the proteins within gluten and within dairy are some of the best recognized in terms of potential immune irritants. So yeah, I use that quite a lot.
Thanks, Ruth. So you've kind of got started with the next set of questions, because I think it's time to get into nutrition now. So gluten and dairy, and I mirror that because I use the same sort of strategies, because I tend to find they're amongst the hardest proteins in our diet to digest for people with who are maybe in the fight and flight and are not producing enough stomach acid. But as you say, they also seem to be the most likely to aggravate the gut-based immune system. What other foods would you maybe recommend removing for, let's say, individual scenarios?
Yeah, I mean, I think it depends on the severity of somebody's symptoms and the chronicity as well, and looking at whether there are other lifestyle factors which can be adjusted first, because often people are a bit hesitant to take out foods that they're particularly attached to. And interestingly, this is probably anecdotal, but I have noticed that people tend to be most fond of the foods that are possibly doing them the most harm, at least in the short term. So if it's really hard for you to give up your dairy, oftentimes people will feel the best when they do give up the dairy for a short period. Anyway, so gluten, dairy, eggs are another one, which are really commonly known sort of drivers for inflammation, but it's the egg white component, because that's where the proteinaceous component is. The yolk's largely fat, so not quite as much of a potential immune stimulant. And then other things can be sometimes nuts, nightshades, those kind of common immune stimulating groups, sometimes lectins, sometimes salicylates, sometimes oxalates. All sorts of things can be, but I would say common things are common, and I usually start with gluten, dairy, maybe eggs, and sort of see how people go with that. But if somebody comes with a very florid, uncomfortable, highly symptomatic kind of inflammatory process going on, then I might use something called the autoimmune paleo protocol for a short period of time, and that takes out all of those key nutritional drivers or potential drivers of inflammation for about 6 to 12 weeks before you then start a gradual process of reintroduction of one food group at a time to kind of test and see in that individual what they might be particularly sensitive to.
Cool. And you've mentioned the time period there, because it can be very overwhelming for people, especially when they've done their own homework on Dr. Google, and then they find the autoimmune paleo protocol and get the book in, and it's like, whoa, okay, I can only eat these things. But clinically, you will work with a time period, and it's basically we almost call it like emptying out the bucket. So the bucket of immunity is overflowing in that person's body, and we're just trying to lower the level of the bucket by taking out a few drivers, aren't we? But trying to avoid the overwhelm in our client or patient.
Yeah, absolutely. And it really does have to be personalized to each individual there, and people's capacity for change and adapting within an already potentially fairly hectic kind of life load schedule. You have to be sympathetic to that, because you absolutely don't want to push them into further adrenal strain and challenge by making them think about all these other things. That said, they can often feel significantly better in a very short period of time. And I would say the minimum period of time is about 21 days. When we're talking about reducing the immune load, it takes about 21 days for our IgG, part of the immune response, to that level to halve. So within about 21 days, if people are going to have a significant positive response to a dietary intervention designed to calm the immune system, you'll see it within about 3 weeks' time. So that's not a huge period of time, really.
So in the chat box, I've been asked about tomatoes, which are obviously part of the nightshade family, and yeah, you will find research or anecdotal evidence of connection to joint pain. It's quite a personalized thing, I think, as you say. Is there anything else you'd like to sort of comment on there?
Just really to reiterate what I've said, I mean, I think whilst nightshades can be a driver for some people, they're not the most common driver. So if you've tried the gluten and dairy approach for up to about 12 weeks in total, and that's made no difference, and you think there may be a nightshade issue, there's no harm in taking those nightshades out for about 3 weeks, maybe 3 to 6 weeks, and see what kind of effect and response it gives to you personally. But there's no broad brush generic kind of answer to this, that tomatoes are the thing. You have to try and test. It's personalised medicine, personalised care.
Thanks, Ruth. So that's the taking out bit, but probably more important or equally important is the putting in bit. So what are the foods and the kind of aspects of nutrition that you're focused on when you've got joint health and inflammation in mind?
Sure. Okay. Well, I think the approach is really very similar for the vast majority of health and well-being concerns, in terms of there are some key building blocks that we need. We think about macronutrients, micronutrients, phytonutrients, and we kind of want to make sure that people are covering their bases there. So I think the most important thing for me is to try not to exclude any food groups. I don't like to demonize food groups. We as human beings are designed to eat a bit of everything. So I try to make sure that's incorporated as far as possible. But I think in terms of macronutrients and in terms of supporting like joint stability from the kind of muscle point of view, thinking really about kind of protein component there. Protein is really high on my list. I tend to focus in on protein requirement as the first macronutrient, and then kind of think about fats and carbohydrates either side of it, depending on somebody's individual sort of training pattern and life load in general. So protein, you hear all sorts of figures bandied around, but I was at the Institute for Functional Medicine's annual international conference at the end of last week, and some very interesting lectures around this in particular, and even up to as much as 3 grams per kilogram body weight per day of protein was being advocated for those with a really high kind of training load, and particularly to support sort of lean muscle mass, and linking that back to joint health. Obviously that's part of the structural stability around the joint itself. So protein really important, and thinking about complete sources of protein. So whether you are an omnivore or vegetarian or vegan, you still need to have your essential amino acids. You need to have complete protein within the course of the day, however you make that up. Thinking about the beneficial fats to include in the diet, and again, if you're talking about numbers, roughly sort of 70 grams ish per day of fat for a woman to support particularly hormone health, and for man it's around about 90-ish, and then we'll be thinking about our omega-3 fats, our healthy fruits and vegetables and nuts and seeds kind of fats to bring in there. So not demonizing omega-6, but making sure we've got the right kind of balance of omega-3 to omega-6 fats and where we're getting those from, and making sure that we're supporting conversion all the way down to kind of EPA and DHA, and not allowing too much arachidonic acid to be produced if we're thinking down the omega-6 side of things. So we need to just think about that. And from a kind of a carbohydrate point of view, I guess, again, thinking about what's needed to support stable blood sugar. We've talked about this at the beginning. So we're thinking about the types of carbohydrates and also the timings. And I guess where athletes are concerned, there is a case for fueling during an extended training session or during a race. And that's different from when we're talking about day-to-day nutrition and adequacy of energy, essentially, because what we don't want to do is end up in an energy deficiency state, because then that will compromise total body health, but it will certainly compromise the health of the musculoskeletal system and joint health then as a direct result of that. So we're thinking about whole foods, we're thinking about minimizing the pesticide exposure, so organic where possible for fruits and vegetables, and wild fish rather than farmed fish, thinking about minimizing the high mercury kind of fish. So there tends to be a heavy lean onto tuna because it's widely available, but actually that's got a really high mercury content compared to other fish. So trying to minimize that and stick with the SMASH group, which is the sardines, mackerel, anchovies, herrings, salmon, etc. So those are the ones which are the lower in mercury and beneficial high omega-3s, and also good source of calcium as well, particularly for people who are not eating large amounts of dairy in their diet. So we're thinking about, I say, organic whole foods, ideally cooking from scratch, and then adding in those nice supportive components in terms of herbs and spices. The things I really love are turmeric, ginger. They are brilliant in terms of a nice anti-inflammatory, kind of a broad spectrum anti-inflammatory, not just targeting one particular pathway like a medication would, for example, but a very broad kind of acting anti-inflammatory, and also really supportive to gut health at the same time. So turmeric has a beneficial impact on the microbiome, and if you're using ginger, that also has a really nice support to the digestive system. People have probably used it for anti-nausea or something in the past, but it's a really good support for our system, GI system. And then cinnamon as well. This, I love cinnamon because this is super helpful for balancing blood sugar. I actually try and put it on every meal because it will help to reduce the intensity of the glucose spike. So it just allows it to come up a little bit more gradually. The other thing that's important for that is to make sure that you've got adequate kind of protein and fibre component to each meal. So people sometimes can go into the weeds with this and think about the order that you eat your food in, but not so much that. It's more about the whole meal. So it's about making sure that you've got enough for your system to be working on, enough bulk to be kind of breaking down, so that what you don't just get is one very rapid release of glucose again into the bloodstream, which is what can happen if you drink your calories, or if you have a meal that doesn't have adequate fibre and bulk and protein and fat to just slow the whole process down. Yes, that's where we get to with that.
Pause for breath, I think there, Ruth. Cool. So I'll just go over a couple of those things. I'll pick up on the protein. I think I just want to emphasize the protein is highly personalized. 3 grams per kilo body mass. Yes, absolutely. It can be used in a sporting realm, but only for certain people pushing it who that works well for them. The omegas as well. I want to emphasize your point, because omega-6 tends to be banded as the inflammatory one, and omega-3 is the anti-inflammatory one, but it's the balance between them. There's not a goodie and a baddie. There's never goodies and baddies in the body because they're all in there. We wouldn't have baddies in the body, but it's when the systems start going out of balance that something becomes a baddie. Let's chat about supplements as well. So do you have certain favorites? Assuming you've covered all those bases, you've looked at blood sugar regulation, inflammation, toxicity, good gut support, a balanced diet, you've looked at the athletes' training patterns and how you're supporting them well. What kind of supplements would you be considering as well?
So I have a few go-tos for most people, and then there are some joint specific ones. So I'll just briefly talk through my go-tos first. So a multivitamin with the activated form of B vitamins in it, and a reasonably high-ish dose of the B vitamins, particularly when I'm thinking about my athletes. So the multivit needs to encompass iron, usually for the men as well as the women, because that one's so readily depleted when we're pushing our systems hard. And want to make sure that we're covering all the micronutrient bases there, which may not be being adequately covered in the diet. And then I will usually bring in an omega-3 supplement, particularly if somebody's not having sort of adequate amounts of fish in their diet. If they're vegan and don't eat it at all. I will usually use vitamin D, because I tend to find that pretty much everybody is deficient in vitamin D, and the requirement for that's very personalised, but people often benefit from some supplementation there. And magnesium also I will use, because this mineral is very, very readily depleted under any form of stress. And for athletes in particular, it can really help to promote kind of recovery and muscle recovery. I like to actually use the glycinate form of magnesium at night for most people, because that really does help support relaxation and sleep. And with the glycine component, it helps support detoxification pathways to some extent as well. So I like that form of magnesium. And then thinking about specifics for joint health, there are usually really nice combination products which have which support the kind of sulfur component, which is so important for our joints. So thinking about like MSM and glucosamine, often these combination products have some hyaluronic acid, manganese and things in there as well. Again, briefly anecdotally, I've noticed that there are certain patients I have who find a huge amount of benefit from the glucosamine MSM combination, and I think if we were to dig into the genetics, we would see that they have certain issues within their sulfur metabolism pathways, which mean that they actually do personally get more benefit from having those components supported. If you try and take their glucosamine and MSM away from them, they notice significant changes very, very rapidly. They don't like it when I suggest that they could trial stopping those supplements and sort of see how it goes. And equally, you add it in for certain people, and they really do notice a sort of an uplift in the way their joints function and feel. So those things, and then also collagen. I will quite often suggest a collagen supplement, particularly if people are not inclined to boil up their bone broth on a weekly basis, but that can be particularly beneficial, along with some creatine, which I guess creatine is more designed or aimed towards kind of the musculature and the support there, but in terms of energy availability as well, I think creatine can be particularly useful for the athletes.
Wonderful, thank you, Ruth. And I've got lots more questions, but we're kind of running out of time, so we'll have to do another one sometime.
Sure.
Can you just finish by telling people how they can get hold of you? Share your website or any other contact details, social media, anything that you'd like to share.
Absolutely. Yeah. So I have my website, which is drruthwilde.com. That's Wilde with an E on the end. And my email address is ruth@drruthwilde.com. Not a very good social media clinician, but if you drop me an email, that's probably the best thing. Or you can also find me through Ian or through Ian's website as well.
Thank you, Ruth. That's been amazing. I really appreciate it.
Thank you, Ian. I love the opportunity to chat with you.
I really appreciate the generous input of Ruth and all my other guests on the Health Feeds Performance podcasts. If you'd like to hear more of my interviews, please subscribe to our YouTube channel or go onto one of the main podcast channels. I'd also be really keen to hear what you would like to hear or watch in the future. So please go onto our website. It's intsportsnutrition.com, and contact us through the contact page and share your views. And while you're there, please have a look at the courses that we run as well. So until next time, bye for now.